Hello, my name is Rhiannon Lester. This is my presentation on leading evidence-based change, the role of the FNP for GNSG 6500 with Dr. T. In this presentation, I will be covering evidence-based practice as it relates to clinical expertise, the importance of evidence-based nursing practice in healthcare. I will discuss a study that exemplifies this, the FNP's obligation to lead evidence-based nursing practice, and we will conclude with a personal story about how evidence was enacted in practice. What is evidence-based nursing practice? It's the implementation of evidence through research into actual patient care, and this is individualized for the patient and compassionate. Why this is so important is it improves patient outcomes. The evidence-based nursing practice leads to higher quality care and better patient results. It reduces medical errors and enhances safety. We see this through the guards that we have in the electronic medical record. When we're prescribing medications, those all come from evidence-based guidelines. It increases efficiency and cost effectiveness. So if we have a guideline that is safe and effective, we know that those steps will get us to our end goal more quickly and therefore be efficient as well as cost effective, and enhance professional accountability by applying evidence-based nursing decisions with our current roles. We know that we are actually taking what we know, best from the research and implementing it. Therefore, we can defend our decisions, we're transparent with where the information came from, and we're practicing at the highest standard of practice. Applying evidence-based practice is important. So we're taking the research and applying it into our actual practice. For instance, the study cost of inpatient falls and cost-benefit analysis of implementation of an evidence-based fall prevention program. So they took this research and they applied this program. It was called the TIPS model to help prevent falls. And by using this model, which was based in evidence, they were able to create the outcome of cost savings from preventing falls. So this shows why it's important to take our research and then apply it to our practice. As FNPs, why is it our obligation to apply evidence-based practice? It's because we can actually interpret the evidence. We know where to find the research-based information, such as wonderful things such as UpToDate, which are evidence-based, but it also blends leadership along with this ability. So we have the ability to encourage others to critically think and question and help them find the answers. We can even have a trickle down to other nurses, whether they are staff nurses versus NPs. All of us need evidence-based information. So being able to mentor others, and you'll see I have that on the side, connecting with new clinicians to evidence-based via structured support. So teaching them where to find information, journal clubs and education to stay abreast of current recommendations and current research, and then role modeling. So showing that you are able to apply the evidence and what you do in order to do that, and modeling that good practice for other NPs that might be younger or new, or even RNs who might not have known to do that if it weren't for you modeling that behavior. This slide will be about my personal experience and conclusion. As an urgent care nurse, where I currently work, we see a variety of illnesses. One of many is are gynecological complaints such as bacterial vaginosis. And just recently this year, it became the new recommendation to have male partner therapy. And this came from evidence-based research. We found it in UpToDate, but they were decided that dual therapy for the female and male partners, even though it's not an STI, but the pH and the microbiome of the vagina can be changed through intercourse. So by treating the male as well as the female, we had less reoccurrence. So in our patient population that has a monogamous relationship where we can treat the male as well as female, we applied this. So these guidelines led to a change of our standard of care, and this is why it's so important as an FNP to be on top of whatever the current research is and know those guidelines so you can give the best, most credible patient care. And these last two slides are my references. Thank you so much for watching.